So in half an hour period, it's not possible to speak everything. This or this? How is that? This one, I think so. But I want you to just to taste how it feels. And you know, in medicine, there are no treatment modalities without reason related. That's why we have diagnosis. I mean, we do not push all the buttons. I mean, if there's reflux, there is reflux. If there's dysphonia, we don't give reflux treatment, antibiotics, and you can say some anti-allergics and every, buttons. If there's reflux, diagnosis and treatment. So I have many conflicts of interest. Voice is muscle. Because everything you see, everything you hear from the body is about muscles, is about a muscle contraction or muscles organize and contract together. And in training principles, they have been being interested in muscle development, muscle training. So this is what they use. There are some principles for muscle training and muscle development. Why don't we use this in voice therapy as well? Because voice is muscle as well. So the first tree is very important for me because for the training of the muscles that we have adapted to the DVT schedule, DVT, DoctorVox voice therapy, specificity, the muscle must be specified to be developed. Overload, to develop a muscle, you need to overload the muscle. No any choices. And you need to wait for this muscle contract like this for some time. To wait for the muscle to be developed, to wait for the brain to be developed, because you also change the brain anatomy by learning some new things, as you all know. So these first three is very important. The first one, how am I going to specify a muscle during voice therapy? How am I? This is the key indeed. So how do they specify a muscle during developing the chest muscles? It's easy because they can touch, they can see what's happening when upper part of the muscle contracts, or from reverse, when you do some incline dumbbell fly or something else, then the upper part of the pec major muscle contracts. And if I continuously contract that part, then the muscle will be developed. This is the reason-related development process. So which muscle is dominant, which vocal pattern? And this is also an important thing. So, and which muscle has what kind of dominancy of the muscle fiber types? Because some muscles contract very fast, some muscles slow, but they do not get tired. So this is a short list of the outcome of each muscle that affects the glottic closure. So we know that the TA vocalis, the medial part of the TA muscle, what does it do? It adducts the lower part of the lower lip of the glottis. So if you want to develop this muscle, it's the chest register muscle, then in order to specify it, you need an action plan. What activates the lower lip of the glottis? What activates the medial part of the glottis? Next slide. If you apply high back pressure, the name is vocal fold, but they are not vocal people. They are breathing people. And they get money from the Ministry of Breathing. And the vocal folds hobby is vocalizing. So they obey the rules first to the breathing, Ministry of Breathing. So the first thing is the vocal folds, the task is a valve. How can you activate this valve? So if you apply a certain back pressure during vocalization, then the medial part of the TA muscle comes in action. How did we find it? For treatment of puberphonia, they speak like this, and then if you apply some back pressure, now it's the same, so I'm going to increase the back pressure. The lower lip does not work now. No. Now it's activated. So you can give this exercise as a homework to develop the lower lip that will develop the chest register, which is the treatment of puberphonia. Muscle contraction related treatment process. So what about, let's say, what about the CT anticus? If you want to have high pitches during singing easily, you know, the singing is a sportive activity, okay? Sportive activity also, not only artistic. So they want to sing high pitches easily. I mean, it means, let's say, this table is 50 kilograms, 50. So if I want to, and I can just lift it. Is it interesting? I don't think so. Anybody can do it. But if I come here, the table, 50 kilograms, and come here and hold the table with 2 fingers, and can you hold this, please? So this is a show. So they need this. They need this show off, because I am on stage. You cannot do this. This is why you need to pay for the ticket to come and see me, listen to me. So if you want high pitches, you need to physically, biophysically, you need to tense the vocal folds. Which tenses the vocal folds? Which muscle tenses the vocal folds? The CT muscle. What does CT muscle, how can you isolate the CT muscle? If you can vibrate with the low falsetto, not the high, it's a little bit complicated, but and then if I do this with some overloading, and I'm doing the CT muscle this time. So this is the idea of muscle-specific voice therapy, and of course motor units are important, the types of fibers, because, for example, the interorythmoid muscle has more fast-twitching fibers. How can I activate the interorythmoid muscle by knowing that the fast-twitching fibers are really dominant in interorythmoid? Do some fast exercises. It's the first one who will respond to the neural firing coming from the brain. So you can increase develop the interorythmoid then. Of course, muscle contraction types are also important in our knowledge, because which muscle contraction type develops stretching or strength of a certain muscle. That's also important. So overloading, how am I going to overload my phonation muscles? The resistance. Am I going to swallow some dumbbells or something else? No. Of course, the semi-occluded vocal tract exercise is a resistance for the phonatory muscles. And when you make falsetto, you resist to the CT muscle. So this is the main idea. And there are many different types of semi-occluded vocal tract exercises, but it's not, I mean, I hope I could explain you well. It's not giving a tube into your patient and do the, why are you doing this? So this must be answered. Why are you doing this? Which muscle are you trying to develop? Because the diagnosis must come first. And only developing the muscles can you achieve the goals. I am a a football player and I am working out so much and I have become like a giant person. Can I play football? They cannot even walk. Well, yeah, I mean, scratch your head. No, it's not possible. So it's not the idea also. So for the adaptation, motor skill here and here, not only the muscles but also the motor cortex is important. And if you want to deal with the motor cortex, you need motor learning principles. And of course, there are many different types of voice therapy techniques. And DoctorVox voice therapy is something like here. That is a direct method which uses vocal exercises. Indirect methods, they don't use vocal exercises. Direct methods use vocal exercises. So it's a direct technique as a holistic approach, and it was born in Finland, but before in Germany in the year 1901. But it was the LaxVox tube that you hold in your hands now, and this is my holy script of Marchetta Sihvo. It was from the first workshop that I got from Marchetta in 2003. And of course, what is our strategy in DVT? When you get into the surgery room, what do? Okay, first of all, let's say there is a cyst. And I have an action plan. I'm going to cut the mucosa, open it, take the cyst out, close it, suture or something else. So it's step by step. There's an action plan here. And then I need, some instruments to execute this action plan. And then there's a beep, beep sound, beep, beep. So I need to listen to that beep, beep sound to follow up my patient. So when I do these 3 dimensions at the same time, then I'm ready to operate. One of them is missing, I cannot operate. So these are the 3 dimensions of DVT method. The first dimension is the action plan. The second dimension is the exercise. The third dimension is the monitorization. And we monitorize our patients with the motor learning principles. So in practice, we combine different disciplines to understand and explain the diagnosis and the treatment of dysphonias. And we also provide, you will not have this, but if you want to humidify, you can just reverse the device and you can just breathe in. Or the quiet rehearsal, it's very important for the singers. Let's say you go to a tour and you are in the a hotel and you want to sing, and there will be a small warning from the room next to you. So please don't be afraid, okay? I tell you. So don't be afraid, I told you. So you can do a full contraction of the muscles, but you can just make it silently, in silence, so that nobody will be offended. But the device, it's a tool. No scissors can make the surgery. It's your hand. When you get the scissors in your surgery, now the golden scissors. No, it's the golden hand. So it's you, but if you have a good cutting scissors, it's better. So what are we doing? First of all, we start with the preset and counsel. We give some basic knowledge, determine the problem, hygiene, and then we give a posture exercise, and we call it the noble posture. It has relations with the laryngeal fascia relations, and if you keep it stable like this, then your larynx is functionally free. And then breathing, low breath is very important in our contacts. And then we explore the primal sound. Now we are going to start. Please drink your water. 3 fingers will stay in the bottle. Don't drink all of it. What? Wow, this is the professional. It's coming from inside. You don't need to think. So, the primal sound is the sound that we make from our bodies without thinking, without culture. For example, I'm coughing, okay? Are you from France? Do you say this? I mean, are you? Because your coughing is French, in French. What? The coughing is, the language is the human language, So whatever nationality or culture you're coming from, you cough the same thing. Okay, I do this. Okay, hello, how are you? I'm so kind, and I need to cough so to take the mucus out, and I do, I'm sorry, but it's still there. You, no, it's still there. You have to do, sorry, but I hear your real sound coming from your body. So that's the primal sound, and the primal sound is the, according to the nuclear satellite model, it's the very important core component of the singing voice, and we do not make any vowel. It's the schwa, neutral vowel for the primal. Say, Some ladies, I cannot, because it's, no, I mean, do you burp? No, nobody knows, I mean, no. So, neutral vowel, it's not a, o, u, no. And then, take the tube in between your teeth and close the tube with your lips, and then, you can use different things, yawning, sighing, humming, coughing, or hey. This is the Stanislavski technique. And then we refine the primal sound, because what about the attack? For example, if you have a hard glottal attack, then you hear first the sound and then the bubbling. But to balance it, I want you to hear the sound in the first bubble. Like this. Wait. If you have a breathy attack, then the first bubble is coming and then the sound. You understand? 3 types of vocal attack, glottal attack, and you can just play with them. The supraglottic activity is important as well while using this. And what is the basic exercises? The basic exercises is, I mean, speaking or singing is a complex activity, but happy birthday to you. But it's the sostenuto, glissando, portamento, or portato, and So these are the basic exercises. Let's do some sostenuto, and first become a princess, and and then hold it. This is the isometric exercise. If you increase the back pressure, then you increase the overload, and if you are making it in chest register, then you develop. If you are making develop the TA medialis. If you are making it the lowest pitch, you develop the lateral part of the TA. If you develop it, if you use the sostenuto in, you develop falsetto and the CT muscle. And then glissando. Like this, you can just draw some bubble, 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 and the sound. And you can see the bubbling must stay stable. You know why? Because I want the rise of the diaphragm stable. That's what they call diaphragmatic rise control. That's the idea. But you don't tell this, of course, to your patients. I mean, now I want your diaphragm to be stably, not that, huh? 5 minutes, okay. And there are some portamento, portato exercises, staccato. Let's do the staccato. And loudness-based exercises. Now I want you to do this. And feel the change when you change the back pressure. I mean, you just... We started 5 minutes late, but okay. And then, of course, you can use the DC valve here. There are some stable loudness, a variable loudness, and then after making the basic exercises, then we combine them. For example, I'm going to play the basketball. First, I just make the dribbling. And then I walk and make the dribbling. And then I walk and jump and dribbling and shoot, whatever. So this was dribbling, walking, jumping are the basic exercises for that complex movement. After making them possible with a new skill, then we combine the exercises. For example, let's do it together. I love these people. So that's, of course, these are all aiming. We started from the falsetto with the staccato exercise. So I created a line between two vocal folds. And then, go to the chest at the same line without opening the back part of the glottis. Because, you know, falsetto, the gap is on the line. And so that's the descending staccato and glissando. And then, keeping the same line, I do the chest register exercise. So this is our corridor exercise. There are two types of increasing and decreasing the pitch. First one is the amateurs and the reflexive one. They show the pitch with the then the eyebrows will also show the pitch. And if they cannot do it, so it's the up and down corridor, like this. But we do it's another type of corridor. So you can have a mixed type of muscle use in the registration. And the linguistic load, until now we didn't use anything but only the schwa without meaning, because we don't want the linguistic centers to interfere with the new vocal skill. And now, unfortunately, you will not be able to do this, but the oral mask combines the vocal skill that transfers this vocal skill to the speech and singing, the same thing. So, I mean, I was walking like this, I learned how to do this, and then I was walking like this. Now I learned how to step properly, and now I learned how to dance with the proper stepping. So it's step by step. And the last portion is the behavioral transfer. Now, without this, I need to use my new vocal skill, vocal behavior on stage or at school or whatever else. So this adaptation is at the sound level, at the linguistic level, and of course psycho-emotional level. They come to me asking, sir, no, in the first session, they were like this, and then they become like this, and they ask this, is this normal? Excuse me? You were speaking like this a few weeks ago, and you're asking, is this normal? This is a perfect thing. Ladies are going to be in love with you when you sing a song with that, is this normal? So, but the psycho-emotional level is in our hands. You have to prepare your patient to get used to the new thing. So for the vocal performer, for development of the instrument, and for daily use, you can use this. And for clinical indications, I would like to show you some videos, but it's so short this time, but maybe next in your country. And of course, if you have any questions, you can just send me an email, and may the force be with you. Now there's the coffee break, and if you wish, you can stay and ask questions, but if you wish, have your coffee and enjoy.